Hi, therapy issuers. Thank you for joining in on our conversation between licensed mental health professionals. This is not meant to substitute a relationship with a licensed mental health professional. Should you become triggered or begin experiencing a mental health crisis, please go to your nearest mental health hospital, emergency room, or dial 911 or 988. And always remember, we are human first and therapist second. Follow us on Instagram, Twitter, Facebook, TikTok, and subscribe to our YouTube channel using the handle @Crave Counseling. This is Therapy-ish. All right, therapy issues, we're back with another episode, and today I have Miss Ashley Minnitt here to talk to us a little bit about the neurodivergent population. And so, Ashley, can you go ahead and tell us a little bit about yourself, your practice, where you are located, social media handles, and those types of things?
Yes, well, thanks for having me. Like you said, my name is Ashley Richardson Minnitt, and so I wear two hats. I have a full-time employment, and I work for UT Austin, running a neurodiversity support program there. And then I have a part-time private practice. You can find me at Ashley R. Let me get this right. Ashley R. Minnitt, LCSW.com. And I do a virtual only practice, only see a few clients a week.
Okay. All right. So we're going to hop into this conversation. What does neurodivergent mean for those who may not be familiar with the term? Like, we hear it a lot, but what does it actually mean?
Yeah. Well, neurodiversity is kind of a new-ish term. So back in the 90s, it was coined by Judy Singer, who really just wanted to highlight the different ways our brains operate. So, neurodiversity says there's like not one right or wrong way about how a brain functions or operates, and highlights that brains do function and process information differently. So opposite of neurotypical. So that's like the neurodiversity umbrella. Since COVID, neurodiversity has really increased the term.
Right.
And so neurodiversity is the umbrella, the theme of how our brains, operate differently, and it's okay. Neurodivergent is a person who identifies as being neurodiverse, and then a group of people is like neurodiverse.
Okay. So we live in a society where it seems like everyone has ADHD. Many of us walk around with 1,000 tabs open in our heads and 1,000 thoughts all over the place. What are your thoughts around the following statement?
Okay.
Technology has induced much of the self-diagnosed ADHD.
I would say technology has created a pathway where people can learn what ADHD is.
Okay.
And it has also debunked some myths. It's also created some, myths out there. I have students talking to me and they're like, "Oh, I saw this on TikTok." And well, that's not exactly right. But what technology has done, it has created more platforms where people can learn about what ADHD is, especially for adults.
Right.
Because a lot of, my peers and older, ADHD was a thing that, oh, this kid has ADHD because they can't sit down.
Right.
And that is, just one little sliver of it.
Right.
So technology has done a lot of good, and there's can be some harmful things with technology, but it's definitely open pathways for folks.
Yeah, that plus and I guess another thought that I had when I was creating the question was we've kind of been forced to have 1,000 tabs open. We've been forced to have 1,000 projects going on. We've been forced to work 2 and 3 jobs because of recession or because of this culture that like you rest when you sleep. So, when you look at like, okay, are people being categorized correctly, right? Because you have people who genuinely are or truly are underneath the ADHD umbrella in the DSM or diagnoses in the DSM, but then you have other people that it's like, okay, is it ADHD or is it anxiety?
Yeah.
Right?
Yeah, well, good question. So, anxiety is, one of the co-leading or co-occurring diagnosis with autism and ADHD. The one thing that I encourage folks to like remember is with ADHD, it's a neurodevelopmental disability. So it's how your brain functions, and it's been there since childhood. So when adults are coming and they're like, oh, I have ADHD, I never knew it. Well, it's always been there, but you probably like slid under the radar because of some of your symptoms and how you presented.
That's fair.
I do think though, our world, we're in this environment where we have to juggle. It's like we're juggling all these things. We're having multiple tabs. And so I think it's really important that you do seek out, whether it's talking to your therapist or like a psychiatrist on, okay, what are these symptoms? Is it truly anxiety, or is my brain operating a little bit differently?
Okay, that's fair because I get so many people, like even just friends, they're like, that's my ADHD brain. And I'm like, you were perfectly fine when we were children. You sat still just like I did. Where is this coming from? But then I guess we'll get into it later on. I think one of the questions gets to it. But there are also like there's ADHD inattentive, and a lot of people aren't aware of that one. All people think is I'm doing this, I'm doing that, I'm doing that. And it's just like, but there is an inattentive type.
Yes. And one thing I want to note with a lot of like adults, cisgender women, their symptoms do appear drastically different than men, and hormones do play an effect. So you're right. So with ADHD, and I'm going to like pull up, make sure I'm getting my definitions right. So you're looking at hyperactivity, impulsivity, and inattentive. And so ADHD, which is attention deficit hyperactivity disorder, people forget about the inattentive type. And with the inattentive, that can be dealing with like memory issues. It can be dealing with, well, some people have a combo of like hyperactivity and impulsivity. Inattentive also has to do with like, you know, emotional regulation, executive dysfunction. So with your like organization, time management, some of those things fall under that inattentive umbrella too.
Okay. Yeah, I'm glad you mentioned that because a lot of people don't realize it's not just task oriented sometimes. Sometimes it shows up in how you engage in relationships with that impulsivity, right? Difficulty making healthy choices in regard to how it could impact other people. So okay, well I guess that was my next question. My next question was, what was the definition of ADHD and what are some symptoms? So I'm glad you went ahead and went into that.
Yes, let's go ahead, and I got my notes here because I was like, the DSM, you know, our DSM had changed, and so
it definitely did.
So right now, ADHD, the DSM definition is persistent patterns of inattention and or hyperactivity, impulsivity that interfere with functioning development. The symptoms have to be present in 2 or more settings and negatively impact social, academic, or occupational settings. So when we're looking at little kids, if you're looking at the hyperactivity or impulsivity, it's what we kind of common see: the fidgeting, the running in place, the jumping back and forth, the not sitting down. But adults, it may look like kind of restless sleeping, like your thoughts are running all the time. So that, you know, is a symptom, and that's what it could look like. When you go to like impulsivity, like, you know, a kid, like, oh, the child's like just bursting out the answers, you know, but impulsivity for an adult could look like you're having a conversation, you know, with friends, and you often go on a tangent, or you say something that has nothing to do with the conversation because you're not tending to like what's going on in your social setting.
Because you've zoned out.
Exactly. And then with the inattentive, that's going to be, you know, do a lot with like that executive functioning. The memory is a big thing. A lot of times inattentive type, they often say, well, the kids probably got away with like C's or D's in school, maybe just barely passed. They weren't on the teacher's radar. They might have been called like lazy or forgetful, and stuff started catching up with them when when things started piling on. They're having more to do. They're having a hard time balancing these things.
Yeah. Okay. All right. So what can parents do to support their children that may have been diagnosed at a young age?
Well, the first thing I would say is really understand the type of the diagnosis, whether it's inattentive, hyperactivity, if we're just talking about ADHD, impulsivity, really understand and figure out your kiddo's strengths and challenges. And I say strengths first because oftentimes, like, our society is conditioned to be like, oh, it's deficit based. Like, you're wrong at this, you're not doing it good at this. And a lot of young adults I work with, they can't tell me any of their strengths or what they're good at. So figure that out first, and then kind of work with them on using those strengths to kind of address some of the symptoms that are there, especially as they progress through age, because it's going to look different.
Absolutely. It definitely changes over lifespan for sure. So one thing you mentioned was like identifying their strengths and their weaknesses. When should parents get their children or teens or suggest that their adult children get an assessment for ADHD? And who do they go to?
Yeah. So for your little ones, you can go to your pediatrician. You can start there as a growing age. You can do like a licensed like psychologist, therapist, clinical social worker. You also can go to your psychiatrist, but a lot of parents don't want to provide their kiddos with medicine. And so before we kind of, they sent me the questions and I was like, oh, this is great. So I'm like going down my rabbit hole of the things I love and, really understanding just kind of how medication works when it comes to kiddos and individuals with ADHD. Yeah. So oftentimes, there is like we all have dopamine in our brain, and the pathway that goes to help with, our memory, our motivation, organization, being productive, individuals with ADHD, they don't have as much dopamine going to that pathway of the brain. So stimulants help facilitate that, help like give that extra dopamine to go to that part of the brain. Well, so that's why a lot of psychiatrists and physicians diagnose that. But I do understand parents, and I have like adults I work with, they're like, I don't want medication. And so,
but it also can be nutritional, right?
It all can be. It definitely can be nutritional. There's the whole body there's a whole body to think about. And kind of besides medication, what you're doing. Are you getting outside? Are you exercising? Are you figuring out other ways to get that dopamine going in your brain to go to that part of your brain so you can be a little more productive?
Absolutely. Okay. Yeah. And there's a lot of people who don't want to go to a psychiatrist. So I get it. The fear that, oh, you're going to put me on this medication. Oh, you're going to do this. And some parents don't realize they can request an assessment too with the school system.
Yes. Let's say that again. You can request assessment with the school. And if your kiddo is fixing to graduate high school, ask for that assessment again, because if they come to college and they are wanting any type of accommodation, that paperwork has to be at least within 3 years.
So this was not one of my questions, but talk about accommodations in college, because there's a lot of people who did graduate high school that have diagnoses related to learning disorders or neurodivergent disorders or even emotional disorders. And they're like, well, I missed all my classes. Okay, what accommodations have you requested? Well, what do you mean? I'm in college. There's no such thing. And I'm like, but there is.
There is. But it's hard, right? Because if you went through high school, You had no accommodations. Everything was great. Right. Or you didn't even have like the paperwork. When you get to college, you don't think like you need that.
Right.
And so to request accommodations for most college campuses, you have to have the paperwork that states, okay, you have this disability and it is causing this type of impairment in these environments.
Right.
And you need certain supports. So for, young adults that are in college or adults that are in college and they don't have that paperwork, you can seek it out. Sometimes you can go to your like counseling center and the therapist on staff maybe can do kind of just general assessments. And I often tell folks, a lot of times they won't diagnose for like your ADHD or your autism. However, they may do a simple like GAD screening or something to see if there's anxiety there or depression. And some of the accommodations that, may be helpful for you if you have like high anxiety can still be helpful for you if you have ADHD.
Right.
So I encourage folks to, seek out that testing, but I'm aware it's expensive. If you can't get it through college, sometimes getting that testing is a little expensive. So work with your resources on your campus to see where like low cost testing is to just get that support.
Yeah. And even like, again, if they have a diagnosis and they've been in therapy for the last 6 months, the last year, whether they got a formal diagnosis at their high school, your therapist can complete your accommodations requests for college. And a lot of people don't know that. I do accommodations requests for college students all the time. I'm like, do you have accommodations? Not all the time, right? I'm not giving everybody accommodations, but there are some clients that I've seen and that I've worked with where I'm like, okay, you're missing all of your classes. You're just so anxious that you're avoiding even reaching out to your professor for support. Like, clearly something is not working. So let's put some formal accommodations in place. So when you get to this high intensity, high stress environment and your anxiety goes through the roof, which is what we've been working on, right? Then you have these things in place and you can use them.
Yeah, definitely.
If you are, ADHD, you can have testing center accommodations where you're not in a classroom, but where you are at a testing center with reduced distractions.
Yeah.
With extra time.
Extra time.
That
is going to be the big thing. And I have a lot of clients too that deal with high anxiety and they're like, okay, well, I have these accommodations in place, but I'm too nervous to talk to the professor. And it's like, well, we have to take those steps because that's how you initiate. So let's role play. Let's work through some of that anxiety. Let's kind of write a script. Let's figure out what we can say, because the only way sometimes you'll get these accommodations enacted is you have to have that conversation with the professor.
And it's weird because a lot of students don't realize that anytime you enroll in a class, your professor gets a ding stating that this student ID number has these designated disabilities and these are their accommodations. So if you're not getting them, welcome yourself. Hi, I'm such and such. Here's a copy of my accommodations, just in case you missed the original email from the university. These are my strengths and these are my weaknesses. And there are going to be some times where I'm not going to ask for my resources because of my weaknesses. But I need you to be aware that if I don't ask for them, to remind me that I have them.
And I tell everyone, I understand if you don't want to come, if you don't want to use them, you have that choice.
Absolutely.
But it can be really helpful to talk to your professor about all your accommodations at the beginning of the semester.
Absolutely.
Because you never know when that time will come where I'm coming close to having a panic attack and I need to turn something in a little late, or I need to use these accommodations. But if we don't have that conversation at first, they won't know.
Absolutely. So, of course, don't abuse your accommodations.
Yes.
Because you will... If you're in college, if you're at a small university, you will have the same professors every other semester or every semester. And so just making sure that you don't abuse them, but be aware that you have them. So even if you don't transfer your documentation over to your university your freshman year, you can still pull your high school records, or you can go to your old therapist and say, hey, can you fill out this accommodations form for me? I know I haven't seen you in a while, but these are the things that I'm still struggling with. Are you able to complete this? Because that even works for, GED testing, but I'm thinking the graduate exams like the GRE, the LSAT,
MCAT, all of that.
those.
Yes,
Yeah, you
all
can
of
get
that.
extra time. You can get small group testing. You can get, I think if you have dyslexia, they have now where they have the integration where it reads it out loud to you.
Oh, yeah.
I think for some of them, not all of them.
Not for all of them, but there's so many different technology resources.
Absolutely.
And don't be worried. Don't be scared on the process, because it is a process, especially for those larger exams, to get those accommodations. But have someone work with you just to get through that process because it's there, so let's use it.
And submit it before the deadline. And every university has a disability center. So that is what the disability center is for. So if you now are in college, you're a junior or senior year, and life is lifing, and the symptoms are getting to a point to where you cannot manage them, the disability center, take all your paperwork, go over there and say, hey, this is what I'm dealing with. How can you guys facilitate me or facilitate my experience at this university and make sure that I don't fall behind?
Definitely.
And they will say, okay, well, when you graduate, we can also help you with your accommodations, requests and letters through said organizations. And you just got to make sure you don't miss the deadline, though, because I think most of those graduate exams are like 90 days. You have to submit the paperwork.
Yes, for the exams, there's certain days. Like at a university or a college, you usually can request accommodations at any time.
At any time.
But for those larger exams, yes, there are deadlines. So I've had individuals I've worked with that we've missed the GRE accommodation for this date, so we have to move it back. And sometimes you just have to do what you have to do if you still want those accommodations.
Absolutely. Okay. So what can adults do to manage their symptoms of ADHD?
Okay. Very similar to, if you're a kiddo, first, learn what type of ADHD you have. If it's ADHD inattentive, hyperactivity. And oftentimes I see adults often having difficulties with like motivation and, emotional regulation, rapid thoughts, restlessness. So kind of first learn the type and start like maybe meeting with a therapist to help point out, okay, this is what's going on. So what are some things I can do to address it?
Right.
Whether, it's, oftentimes I work with a lot of people that have motivation issues. So it's like, hey, do we need to create novelty in my routine? Especially for like, a lot of individuals with ADHD, whether it's, inattentive or hyperactivity, need novelty in their day because it's like they, unlike ASD, they need that change.
Right.
Do you need to create urgency for yourself? Do you need to set some timers to make sure you're getting things done? So really reach out to, different clinicians or experts in the field that can work with you on addressing those symptoms.
Okay, so what is autism and what are the early signs of autism? We see so many people, at least now, like in our adulthood, where it's starting to like come out, be like, people are like, I got an assessment and I was diagnosed with autism, and I never realized that that's why I struggled in social settings.
So autism is my love. I've been, that's been my specialty for over 12 years. So it is a spectrum because first, let me back up here. When the DSM-5 came out, they put a lot of diagnoses that were similar to autism under one umbrella. So previously...
Like Angelman's?
Pervasive developmental disorder, Asperger's syndrome. So that was all, it, had its own diagnosis. When the DSM-5 came out, they were like, okay, we're going to put it all under one umbrella and we're going to, address the diagnoses in levels. And it still focuses on like two things, like social communication and challenges with social communication and repetitive or restrictive patterns of behavior. So those are kind of the two buckets that they're looking at. So for social communication, you're going to have maybe difficulties with like, verbal communication or nonverbal communication. So that's recognizing body language. That can also include, social awareness in situations. So we have language, social communication, social awareness. So knowing those like nonverbal social cues when you enter a room, what to say, what not to say. You're also going to have, we have our language, our social awareness. I have my notes here to make sure I don't. Narrow interest. So that's going to be specifically like I have a specific interest and I have a hard time diverting from that interest, because oftentimes people are like, well, I really like basketball. Well, if I sit here and have a conversation with you about basketball, if it's hard for you to jump to another topic, or if it's hard for me to get us to go to another topic without you going back to it, that kind of falls under that really narrow interest. And then you're also going to have like, difficulties with sensory processing.
Right.
And that's going to be, how you process information, but also like how you are processing things in your environment.
Right.
So some individuals are hypo or hypersensitive to things in their environment. So hyper is like, I'm picking up every last thing in this environment. Right. Things are really loud, whether it's like the lights in here, I can hear the buzzing. And the hypo is I'm not as aware. I don't, have that same feeling when it comes to some things in the sensory environment. And that can even be as small as when I'm in a social setting, not being fully aware of things in my environment and talking over someone when they're speaking, because I am not, fully sensitive or aware to the sounds going on in my environment.
Right. So when you say sensitivity and space and environment, would that include all the 5 senses? Because usually when I hear people talking about autism, it's usually like touch and sound versus, touch, sight, and sound, but like scent, smell,
smell,
and touch is and taste.
Taste, yes. Yeah. Smell and taste, yes. So I have worked with a lot of individuals that certain textures of foods, they can't really do certain textures, and even kind of some littles on the spectrum. I've worked with kids that have a hard time swallowing or chewing, and there's other oral motor issues going on there, but that is like a sensory difficulty they have. And then we said taste and touch. So besides like, the pressure on your skin, the feeling of clothes and textures, that's huge. So whether it's like soft pants, I have had work with individuals that are like, I can't deal with like the tags on my shirts or, even the texture from certain, or I've had kiddos say, well, the detergent and the feeling of the detergent from like after the clothes come out of the washer and dryer feels very a certain way. Yes.
Very sensitive.
So,
Okay. All right. So what therapeutic interventions would you recommend to support with managing autism? So things like BCBA, which is, I forget what the acronyms actually stand for, audiologist, occupational therapist, etc. And then which modalities would you say are the most harmful of the ones that you gave us for those who are seeking autism services?
So that's going to be a controversial topic there. So the acronym you mentioned, BCBA, is a board certified behavior analyst. And BCBA's practice applied behavioral analysis. So ABA therapy. And there has been lots of talks on the good and the bad of ABA therapy. And, what I can say is when you are connected with the right therapist that helps you and your kiddos address the goals that are presented, it doesn't matter if it's a BCBA, a OT, a PT, a LCSW, they can provide that support.
Right.
And so I would say the model that works best is going to be the model that is addressing the needs of the kiddo instead of like correcting a behavior. I think that's what, that's what happens a lot. It's like, okay, we need to stop this behavior.
But does that fall under the ABA? Is that a part of their like?
Not technically. And I think that's where things have been misconstrued a lot. And I'm not a BCBA, but I've worked with a lot of BCBAs. And so I have seen all levels. I've seen where we're correcting this behavior, but I've also seen where we're teaching skills.
Right.
So teaching you how to perform this skill that you need to function in this environment. But some individuals do need the support where you are addressing maybe a behavior that might be aggressive or self-injurious. And so there's multiple points. A lot of advocates out there now are saying, okay, you can address the behavior, but you can also figure out why the kiddo is doing this behavior, because every behavior has a function.
Absolutely.
And so, and that's one thing that, BCBAs do look at. They look at the function of the behavior, but a lot of therapists, whether it's, clinicians, OTPTs, they will, if they've been trained, they'll look at the function of the behavior and addressing that function. And so there's ways to address the function without, harming the kiddo.
Yeah. Okay. Because I've heard some controversy around ABA and BCBA. That's what made me really ask the question, because I think a lot of families are pushed into one modality because that's the it modality, right? But it's like, okay, if your child is struggling with sensory processing issues, although they are having this maladaptive response to it or behavior following the trigger, right? Sensory processing, you might do need an audiologist or a occupational therapist to co-facilitate that journey for your child, because yes, we do need to work on the behaviors, but let's work on this sensory processing issue first.
Yeah, so OTs can definitely come in handy addressing sensory issues. And even when they're little, a lot of times BCBAs are helping them gain certain skills that they haven't acquired yet. Because you ask, like, what are some of the symptoms? Which I don't even think we addressed it, but quickly, the symptoms of when kiddos are little, with autism, if they're not hitting some of their developmental milestones, that's when you start to kind of, your ears should start percolating. It's like, maybe let's talk to a pediatrician. So that's going to be walking. That's going to be talking. That's going to be socially communicating with, their peers around them. So not just verbal communication. We look at play. Is your kiddo, actively engaging with, the kiddo at the playground, or are they just playing beside each other? Are they functionally playing? He has cars. Is he stacking the cars, or is he rolling the cars, or is he lining the cars up? Is he being functional with that?
But those are just basic things that parents don't pay attention to anyway.
Yes.
But do kids play anymore? But never mind.
Well, and I have a really good friend that's a speech therapist, and he said, because of COVID, a lot of language delay. Languages have been delayed, and a lot of kids are starting to pick up on some of those play skills a little late. However, it is noticeable if the kiddo is not functionally playing with the toy. And oftentimes imitation's another thing. So I have a nephew, and we'll play phone, and if I pick it up, say hello, I would want him to say hello back, because that's imitation. And that's another thing that kind of clinicians will look at if those milestones, when it comes to hitting those milestones.
Okay. Well, thanks for sharing. That's a lot for me, right? Yeah. I mean, I don't have any children, right? Yeah. But even though I'm a therapist, I worked in a middle school space, so I would have never thought to pay attention to that. Even me being a play therapist, I work with children, but I don't typically get the autistic population. So the kids that I work with, they are doing the things. Yeah. So I would never know to pick up on some of those things, especially because I don't specialize in it.
Yeah, and that's one thing that all clinicians are going to look at when the kiddo's little and they're doing assessments, whether it's BCBA, OT, PT, LPC, LCSW, they're going to look at, like, are they hitting their milestones? How's their receptive language? How's, all of those things, they're going to look at that.
Absolutely. Well, they say, it takes a village to raise a child, and just having access to people who can check those things for you. Yeah. Because, when kids are in elementary, sometimes they go under the radar and the teachers don't know teachers aren't trained to pick up on what you just said. They just know this kid isn't behaving or this kid is aggressive. Those are the things.
Yes. And especially for individuals of color,
right.
where these kiddos are often misdiagnosed. Mm-hmm. So autism can be there, but instead they're getting like oppositional defiant disorder or emotionally disturbed. Sometimes, ADHD when it's actually autism. Right. And then when it comes to girls too, because a lot of their symptomologies are not as prevalent. Mm-hmm. I don't say prevalent, or not as like out there or noticed until they become a little bit older. Yeah. And so that's another thing that makes it where those diagnoses aren't happening as early as they should.
Yeah. Well, I mean, I think it's fair to just take your child to check on them.
Yes. And parents, like, I'm not a parent, but your kid. And if you feel like something's off, I don't know what it is, it's okay to seek help and ask questions and get a first opinion, a second, a third. This is true. It is okay to do that and get all the supports.
I remember, this is an aside, right? I remember when I was a kid, my grandmother told my mom that she needed to go get an assessment on me because I didn't respond. So they would talk to me and I wouldn't respond at all. I would just look straight. So for the longest, they thought something was wrong with me. So they took me to the doctor. They did an assessment and the doctor was like, oh, she's just ignoring you guys. She can hear. Yeah. So, but it took, luckily, our family was like, no, something's not right. Yes. At least to check. Yes. Clearly, it was nothing wrong.
But some families are like, well, no, everything's fine. Okay. And it may be okay. And like I said, I'm not a parent yet, but I've worked with so many parents, and I'm like, let's err on the side of caution. Absolutely. Let's do everything under the book. Let's do all sorts of testing just to make sure that we're not missing anything. Right. And I kind of tell parents, I will feel like I'm doing a disservice to you if I don't look at everything. Yeah. And encourage you to do that.
Absolutely. Grew up and I ended up just being an introvert, and I don't like large settings. So my grandma's like, you still the same. Okay, so what are some ways in which you support these populations in your business?
Yes. Well, as I said earlier, so my full-time job, I run a support program for neurodivergent students at UT Austin. So that's my daytime job, and we support college students who identify as being neurodivergent and providing that one-on-one support. But in my private practice, I see a little bit of everything. A lot of, young adults, women that are just going through a lot of transitions. Some have ADHD, some have autism, and a lot of people I work with, they are diagnosed later in life. So it's like, I'm 36 and I now know I have ADHD or autism. So what I really work with them on is first understanding what it is and using time to debunk myths, and then working with them to kind of address some of their challenges, the challenges that they are experiencing. Yeah. So one thing that I do when I work with clients is, because I have for so many years worked with individuals, I like to say, whose brains just operate a little bit differently. Absolutely. Standard therapeutic interventions don't always work. They don't. And I've had so many just students I've worked with say, well, I went to the therapist and nothing happened, or I didn't feel like I got a takeaway. And it's because for some folks, especially with ASD, autism, we have to teach the skill and then kind of work with them on that. Yeah. And so, because a lot of times they don't have the skill or understand the skill or know how to generalize the skill. So we have to teach first. And in school, we're not taught, as therapists, it's like, let's be the guide. But for, an autistic individual, they're like, I don't need a guide right now. I need to understand, and learn this process. Right. And then I can go and, you can guide me. Right. So kind of start with them there on that.
Okay. If you could offer one piece of advice for each, meaning ADHD or autism, when communicating with parents, what would it be?
Listen to your kid. And I say that because listen to the kid and observe your kid. Okay. Listen because depending on the levels of support they need. Let's start with autism. If they don't need as much support, they are going to either tell you or through some of their actions, display kind of what's challenging. And it's like, listen, and you might have to ask specific questions. So we have to kind of reflect on the questions we do ask to get like the responses that you're seeking. But, listen and kind of allow them to guide you on kind of the supports they need. You be that helping hand. You definitely do that because they are going to need certain support. But when they get to a certain age, they are going to express what they want and what they don't want. And oftentimes I think we're so keen on, well, no, you need to do it this way. This way is better. But we have to let them experience that as well and build those self-advocacy skills and those decision-making skills that oftentimes they have difficulty with. Yeah. So for sure, and I'm speaking of, folks that may not need as much level of support. For, folks that, kiddos that do need a little bit more support, my biggest advice would be, build your network, your community. Build your tribe. Yeah. Build your tribe.
So key.
And that's going to be for, whether they need like minimal support or high level support. Build your tribe. And this is for ADHD and autism, because once you have that tribe will be able to support your kids' goals, needs, whatever it is. So that's going to kind of be my biggest advice.
Yeah. And when you say tribe, you're talking about tribe with build a tribe for your kids and for the parents, because the parents get to a place to where they're so overwhelmed. They're like, I need a break. And, some mom groups who, like, for example, ADHD kids or kids who have autism, they're like, oh, we're taking the kids to the water park. Send your kid. And you're like, oh, I needed that break because my child is a lot and I just can't handle it.
Yes, build the tribe for both, because, we're clinicians sitting here, but we don't have the lived experience of the kiddo or the parent. And so I always express like, okay, I specialize in this area, but I'm not the experts because I don't have autism or I don't have ADHD. Now I probably need to get tested for ADHD, but that's neither here nor there. But I'm not the expert, you are. And so really you need to find other people that have similar, have gone through similar things, can provide that support for you as a parent. And then those kiddos need that tribe too. They need the tribe of adults that are going to support them, but also like kids that they can connect with as well.
Absolutely. Okay. So tell us your social media handles, your website, your company information again. And we are going to make sure that's shared.
Yes. Well, the best way to get in contact with me is you can reach me at my website, which is Ashley R. Minnitt, and that's MINNITT, LCSW.com. You can reach out there. And that is going to be kind of the key place you can find me for my private practice. If you are a young adult that's in college, and if you need supports at UT Austin, you can just kind of at UT Austin Google Longhorn Ties, and you will find like our support services there. But yeah, just definitely reach out.
Okay. One more quick question. Do you accept insurance?
I do accept insurance. Okay. Yes. So I accept Aetna, United, and Blue Cross Blue Shield right now. Okay. Those are the most popular ones. And I am part-time, as I do have my kind of full-time running this program, this fabulous program. But my summer hours are changing, but definitely reach out because I am taking new clients.
Okay. Thank you.
Yes. Thanks for having me.